Okay, and off you go.
Okay. Hello everyone. This talk today is about the role of ultrasound in detecting a visual indicator in the epididymis of the testes called the filarial dance sign on ultrasound. It's originally thought to describe a disease that people would have to see that sign on ultrasound. So today we're going to have a talk about what it is, what it looks like, and whether or not it's an indicator for disease or other reproductive issues. So firstly, what is the filarial dance sign? The term filarial dance sign describes the twirling motion of echogenic foci within the epididymis of the scrotum. It's made more obvious by unusual amounts of fluid within the epididymis, and it's called a dance sign because the echoes, that twirling motion, they're said to be dancing. The characteristic of the FDS was first reported in 1994, where the random to and fro movements of the tiny echogenic particles, which was believed to represent adult filarial worms, or microfilariae within the epididymis of men who are infected with filarial disease. However, recently, multiple studies and theories are questioning if the dancing movement seen in the epididymis, the filarial dance sign, is the filarial worm and indeed an indicator of the disease, because a lot of people are coming back histopathologically getting tested. It's all coming back negative, but we're still seeing this sign. Okay. So what is lymphatic filariasis? According to the Centre for Disease Control, it is a parasitic disease caused by microscopic thread-like worms. It's little wormy. The adult worms, they live in the human lymph system, which is a complex network of vessels and nodes that maintain fluid between tissues and blood. It's basically caused by 3 different species that are known: the Wuchereria bancrofti, the Brugii timori, and the Brugii malai. Most infected people are asymptomatic. There's no real sign, no early detection for filariasis, despite the fact that the parasite is damaging their lymph system. A small percentage of people develop lymphedema, and this is caused by an improper functioning of the lymph system because the worms are living in there, which results in fluid collection and swelling. It mostly occurs in the lower extremities, but it can also occur in the arms, breasts, torso, genitalia, and internally can enlarge organs such as the liver or spleen. The swelling and decreased function of the lymph system make it difficult for the body to fight germs and infections, so those affected will tend to have more bacterial infections than those who don't. It causes a hardening of the skin, which is known as elephantitis. Men can also develop hydrocele or swelling of the scrotum, although not all of those with a positive filarial dance sign on ultrasound have the associated hydrocele. Filarial infection can also cause tropical pulmonary encephalia syndrome, which sees symptoms such as coughing, wheezing, and shortness of breath. Lymphatic filariasis is a vector-borne disease. So during a blood meal, an infected mosquito deposits third-stage filarial larvae onto the skin of the mammalian host, where they would migrate and penetrate through the bite wound and into the lymph system. In the host, they actually develop into the male and female worms, and female worms will reproduce and release microfilariae into the mammalian host after mating nocturnally. They migrate into the lymph system and into the bloodstream, which reaches the peripheral blood, and the microfilariae are the diagnostic stages of infection, so they're responsible for infecting the other mosquitoes. So when a mosquito comes and takes blood from somebody, they don't take a full worm, they actually take the little babies, the microfilariae, and that continues the transmission of the cycle. Over 120 million people have been affected by lymphatic filariasis, and of these, over 40 million are seriously incapacitated and or disfigured by the disease. 1/3 live in India, 1/3 in Africa, and the most of the remaining are in Southeast Asia, the Pacific, and the Americas. Tropical pulmonary encephalia syndrome is typically found in Asian filarial patients, though. In tropical and subtropical areas where the disease is well established, the prevalence of infection is actually continuing to increase. Scientists believe it would take multiple mosquito bites over a longer time span from months to years to be at a high risk of contracting the disease. So short-term tourists and visitors are at quite a low risk of contracting the disease when they're in those countries. As a side note, I do know that my map has done a Woolworths and forgotten Tasmania, so I'm sorry about that. So how do we diagnose it? The standard method for active infection is identifying the presence of microfilariae in a blood smear under microscope. However, because microfilariae circulate in the blood at night and lay dormant during the day, blood collection has to be done at night to gain a higher concentration of possible infection within the blood. If nocturnal samples aren't feasible, then they would use a provocation with an oral medication a couple hours earlier to try and make them move. The in-house enzyme, however, that detects filariasis within the blood, it can't differentiate between those 3 species, and it can't actually tell whether the infection is present or past. So if it's a past infection, it can still show up in the blood, and it may not actually be active at the time of testing. Because lymphedema develops many, many years after being infected and a lot of people don't show symptoms, lab tests are likely to be negative with most patients. Ultrasound is the only known method that can test for the positive filarial dance sign, which could indicate active infection at the time of testing. So it's the only method that can possibly show active infection at the time. Quickly, treatment is both 1 and 12-day antiparasitic drugs that are taken orally, both said to have similar effects, and that's 99% effective in removing the blood from the worms from the blood, but that's only for a full year after treatment. So here, obviously we've got pretty decent hydrocele. So he's obviously got lymphedema as well. You can see that in the skin. So for someone like this patient, he would need to have antibacterial soaps, regular washing, which is daily, because that promotes the flow of the lymph system, which will result in less inflammation, and it acutely will improve the elephantitis itself. Surgery for men with hydroceles. The World Health Organization has recognised that the disease is spreading, and regardless of how much treatment they're trying to get out there, it is still getting worse. So they've vowed 1-day treatments for all in areas that are affected. I've just got some fact sheets if anyone's interested. That's just their statements on ongoing preservation with what to do. Okay, so we know that the filarial dance sign is a physical indicator in a male scrotum when we're seeing them. But I thought I'd actually throw in a couple of examples of ultrasound and other modalities in checking for this infection before going into the testicular stuff. So here we've got a lady who has obviously presented for mammo and ultrasound. She had a lump in her left breast. So over on this side here, for those who don't do ultrasound, we've got breast tissue. The black basically is fluid, okay? And then you've got the thread-like echogenic echoes, which is the worm. It's much easier to see on the mammogram. If that infection was active at the time, then they may have possibly been able to see the movement in the echogenic echoes through the breast ultrasound, and if not, they could have used a power Doppler to show some movement as well there. So obviously they're looking for a cancer and quite different. This is a patient who's presented with a superficial lump in the eyelid. So again, where the arrow is up on the left-hand side for ultrasound, you're getting that same appearance. So you're getting the thread-like echogenic echoes. Again, you've got that inflammation, that fluid around it. It's an MRI over on the left-hand side. And down the bottom, that's just showing what it would look like as a superficial presentation in the eyelid. So it's not just ultrasound that can detect it. It doesn't just go into the testicles, and it can be anywhere. These are just some examples of where they could go and other modalities that could help find it. And this one here, this is an upper limb ultrasound, so looking for a DBT. So this patient's presented with a superficial elongated lump, which they thought was obviously thrombus. But basically what you've got here on the left-hand side, you've got basically a cystic, so fluid-filled tubular structure. Those echogenic, again, thread-like, worm-like echoes are actually the worm. You've got the axillary vessels sitting underneath them, and with the colour Doppler on the right-hand side, you can see a normal colour fill through the vessel, which you would expect through vessels or vascular ultrasound. The small little bits of coloured Doppler through the cystic, which is actually probably going to be the lymph system that's elongated and inflamed there. That colour, you wouldn't normally see that inflammation, but that's probably showing that little bit of movement as the worms are moving around. So again, it just shows that it's not just testicular, it's not just the swollen scrotum and the big legs that you would expect to see and that you hear about in all the stories. It is in other places as well, okay? Okay. So most of the patients that we know that are coming in for testicular ultrasounds are coming in for different reasons. So we know that the filarial dance sign can be an indicator for that disease, but what if you have a patient that comes into your department, you're seeing a filarial dance sign and they have no previous history of spending any time in endemic areas? This question is what's actually been prompting a lot of studies in the last few years. It's always believed that the filarial dance sign would represent that disease. Now people are questioning if you've got patients coming in, you're seeing that sign, but they're testing negative to the disease, what else could it represent? What else is it causing? So very quickly, for those that have forgotten or aren't familiar, the epididymis that we've been talking about is basically a tightly coiled duct within the scrotum, and it collects sperms from the seminiferous tubules where they're actually produced. It's a crescent-shaped duct. It runs longitudinally along the back of the testicle. And as its walls become longer and thicker, as you can see as it's going up, it becomes the vas deferens. Sometimes the epididymis can become blocked, which prevents sperm from entering into the vas deferens and getting into the ejaculate to be excreted. A blockage can happen either bilaterally or unilaterally, and it can happen together or it can keep happening. So they're saying that they're believing now that blockage is an indicator of the filarial dance sign. So the moving particles that we're seeing on ultrasound are no longer believed just to be worms, that they could actually be sperm, they could be dead cells or calcific deposits which are floating around within the epididymis itself. A lot of clinical experiments are noting a high number of patients that are presenting with a filarial dance sign that have a negative test for the disease are actually post-vasectomy. So what can cause blockages? They can be natural hernia or hydrocele repairs. They can be a result of STD infections because of the epididymal tail inflammation. It can be caused from trauma or scar tissue, which would block the epididymis, cysts and stones within the ejaculatory ducts, prostatic infection, and again, inflammation and blockage to the ejaculatory ducts, and vasectomy. So down the bottom, that's actually showing the epididymis with sperm within that tube of the epididymis. So you can sort of look back to those elongated echogenic pictures that we saw of ultrasound representing worms. So you can see why they're saying it could actually be sperm as well. Very similar appearance. Okay, so a physical examination can indicate an obstruction. The epididymis should feel long and hard. So if they're feeling a flat section along that, then that can actually indicate obstruction. A man who has a bilateral obstruction would have a 0 sperm count in the ejaculate and be called be referred to as azoospermia, and therefore they'd be able to be diagnosed with other tests. Under ultrasound, a biopsy can be performed, so you could actually see that filarial dance sign in the epididymis, get in there with a biopsy and take a sample so you can actually see whether or not we're looking at sperm or worms. If a diagnosis was to be azoospermia, which is that bilateral blockage with no sperm count in either ejaculate, they can do a transurethral resection of the prostate or TURP procedure. If the sperm was unaffected but the release of sperm into the ejaculate was what the problem was, they can do a bypass, and that there is known as a vasoepididymostomy. In patients who have no such blockages after any of these tests are performed, but still present with a filarial dance sign on ultrasound, they're saying that rather than it be a blockage or sperm particles floating around, that it would be megasperm, and you're actually seeing those sperm themselves moving around and through. Well, that's just that bit. So basically, in conclusion, the sonographic appearance described as the filarial dance sign was once believed to be 100% accurate of diagnosing filariasis in a patient. However, we're finding that more and more patients from non-endemic areas are presenting with it. So, excuse me, now they're saying it could be a manifestation of epididymal obstruction. Factors to be considered when scanning scrotal ultrasounds and seeing the presentation of the filarial dance sign are to note the country of birth, any exposure to the filarial infection in the past or travel to a filarial endemic area, previous scrotal surgery, especially vasectomy, any previous or current scrotal inflammatory diseases, and congenital testicular abnormalities as well. The unifying condition in patients with the filariasis and those who don't have the filariasis, when the FDS is observed, has been lymphatic obstruction, and that may be the underlying appearance in both groups. It is our duty as sonographers to ask as many questions as possible and to gauge what the underlying appearance could be from. There's many mixed views as to whether there's no definite answer as to whether it's filariasis, obstruction or sperm. But when we're scanning our patients and we're seeing this sign, we need to make sure we're asking those questions, make sure we're getting as much information as possible so that our radiologists can decide which way we're going to go for testing. Okay, biopsy is quite invasive and quite painful. So something as easy as doing a blood test or doing a diagnosis, a physical examination, looking for blockages that way, we need to be asking those questions.